Welcome to Addressing Vaccine Hesitancy. This is an Answers for Pediatricians. It's brought to you by Boston Children's in collaboration with the Massachusetts Department of Public Health. My name is Kristen Dottoli, and I'm the Director of Enterprise Communications here at Boston Children's, and I will serve as your moderator for today's webinar. Just a few quick housekeeping items. This webinar is being recorded, so if you miss something or if you would like to share this with some of your colleagues, you'll have the chance to do so. The link of this video will be made available shortly after we wrap up here. So for more information on all things COVID related, please feel free to visit our BCH website dedicated to content around COVID-19 at bostonchildrens.org/COVID-19. So let's get into it because I know we have a lot to cover today, and we have some wonderful panelists that are going to help guide our discussion today. And I would like to take a moment for each person to introduce themselves. So if we could just start first with Dr. Sherry Nethersall. Sherry?
Hi, everyone. I'm Sherry Nethersall. I'm a pediatrician. I work in the primary care practice at Boston Children's Hospital, where I've been for about 30 years. I'm also the executive director for community health for the hospital, so I oversee our community health programs and activities.
Thank you. Dr. Madoff?
Hi, everybody. I'm Larry Madoff. I'm the medical director for the Bureau of Infectious Disease and Laboratory Sciences of the Massachusetts Department of Public Health. I'm an adult infectious disease doctor, but in my work, do a lot of work with our immunization division that oversees the vaccines for children and all of our pediatric outreach in the state as well. I've been involved in issues surrounding vaccine confidence for a number of years. I'm pleased to be here today on behalf of DPH.
Thank you so much. And Dr. Polanco.
Hi, thanks so much for having me today. I'm Dr. Polanco Walters. I am a pediatrician and adolescent medicine trained here at Boston Children's Hospital and also seeing patients at the Martha Elliott Health Center.
Thank you so much. So to achieve sufficient herd immunity and to hopefully end this pandemic, 70 to 90% of the population needs to be vaccinated. And an often missing piece of reaching herd immunity in this case is children, who make up about 22% of the American population. So we're hosting this webinar to address vaccine hesitancy specifically because this has been a significant challenge for public health. So let's start with some vaccination updates. Dr. Madoff, can you please share how is Massachusetts doing overall and where is this trend going?
So Massachusetts has, so to back up for a minute, Massachusetts has been a leader in immunization in general and in pediatric immunization in particular for the dozen or more years that I've been with the department. Massachusetts always ranks among the best in the country, often number one in the US around pediatric immunization in general. And we've done that, I think, successfully through partnerships with the pediatric community, working with the Mass chapter of the AAP, working with providers, offering conferences and outreach and immunization updates, and of course in providing all vaccines to children free of charge throughout the state, both through the federal Vaccines for Children program as well as through our own trust fund that the state administers, but is the insurers fund to provide all vaccines to all children everywhere in the state, regardless of their financial need. And so because of this, we've always we have rates of vaccination that are well exceed the high 90% ranges for say for kindergarten entry. And so we do very well, but even with vaccines that aren't required for school entries, for example, flu, we have led the US for years in rates of pediatric influenza vaccination. So we do very well in general. And in terms of COVID, Massachusetts, of course, pediatric patients have not largely been included in COVID vaccination until pretty recently. But we now have close to 4.5 million people in the Commonwealth who are fully vaccinated by CDC criteria, and nearly 5 million who've gotten at least one dose of a COVID vaccine. 4.9 million was the last number that I saw. So we're doing very well. Now the rates of vaccination, because of our very, I think, conscious effort to prioritize those at highest need for vaccination. We started with healthcare workers and the elderly, and have sort of stepped down in age, and so our vaccination rates are very high among elderly, among those over 65, say, that well exceed 80% of those eligible to be vaccinated, and then decrease. And as those 12 and older have only fairly recently been eligible to receive the Pfizer vaccine, but still more than 50% of eligible people in that age group have been vaccinated. So Massachusetts has really led in these efforts, and has been also, I think, a leadership in an equitable approach to vaccine distribution, prioritizing minority populations, harder to reach, more impacted communities. We have a vaccine equity initiative that reaches out to the 20 most impacted communities in Massachusetts, and that will continue as we approach pediatric vaccination. So I'll stop there, but in general, we've done fairly well. Of course, there is room to go. We could always do better. And I think it's reflected in the fact that our surge here, our fourth wave, if you will, of COVID in Massachusetts, while it's serious and concerning, is less than is being seen in most parts of the country.
Yes, no, of course. And so those are great statistics that you mentioned about Massachusetts. And I know I'm grateful that I live here in the state of Massachusetts. What are some of the things that the state is doing to encourage more vaccinations? I'm seeing a little bit of an uptick, from last week to this week. It looks like the vaccinations have gone up a little bit. What are some of the things that the state is doing?
Yeah, so we're just continuing to, well, so we could start with Vax Millions. Just to start on a lighter note, I guess, the lottery, trying to incentivize vaccination, of course, is a big piece, and trying to get people enthusiastic about vaccinating by offering $1 million, or for those under 18, offering college scholarship funding. And so that's an incentive piece of the puzzle. The state chose a large venue approach early, to try to, the Gillette Stadium and Fenway Park venues, to try to get, just to efficiently vaccinate as many people as possible. But there are so many places to get vaccinated now. Almost every retail pharmacy, many provider offices, many healthcare institutions, many larger practices offering COVID vaccination will make the vaccine available to any provider who can meet a decreasing minimum number of doses. And we want to balance trying to avoid wastage of vaccines, but really pretty small quantities can be ordered and used by provider offices at this point. And as I mentioned, our vaccine equity initiative, where we have ambassadors in 20 communities, and real efforts through events, through even door-to-door outreach, to try to get people vaccinated in the places that have been most impacted. All of these efforts are continuing. At this point, availability it's very easy to get vaccinated. Are there things we could do to improve that? Yes. But there are things that maybe we at DPH can't directly address. For example, there are people who are concerned about missing work to get vaccinated or because of side effects of the vaccine that might keep them from working, and that's something I think we could improve on by better sick leave efforts and that sort of thing. But I think in general, availability of vaccines is good. It's pretty easy to get vaccinated if you want in Massachusetts, and we have a big public relations campaign that uses social media and videos, PSAs, as well as I mentioned, personal outreach to get people vaccinated.
Yeah, and I think the personal outreach, I think, is going to be a tactic that I think will be most effective. I mean, even if it's just within their own community. But you did touch on something that I would love to talk a little bit about, Dr. Polanco. In terms of we're calling it vaccine hesitancy, but I almost feel like we're at a point where there is sort of like not just hesitancy, but there's like a spectrum of where people are at in terms of getting this vaccine. It's not just flat out, I'm not interested in vaccine. Just in terms of what you're seeing specifically, could you talk a little bit about, your thoughts about, common decision-making around the vaccination in general, things that you're hearing?
Yes, definitely. And I want to preface this by saying that all our patients have specific concerns and questions about the vaccine, and they should be addressed individually. We cannot just group everyone into just a vaccine hesitant group, as you mentioned. The other thing we need to think about is that a lot of our patients are unsure about the vaccine because they've never experienced diseases that vaccines are designed to prevent. So this is something new for them, that even though they take these vaccines, or their children take these vaccines, they haven't experienced the diseases that we usually prevent and have done such a great job preventing. And then finally, just to say that our patients, most of the patients, at least most of the families I interact with, they're not opposed to vaccination. They're seeking guidance. And one of the things that I mention all the time is a lot of my families are telling me that the parents are vaccinated and they're just waiting. They want a little more time to see what happens with the young ones. But to answer your question in terms of decision-making around vaccination, it entails a complex mix of cultural, psychosocial, spiritual, political, cognitive factors, etc. So reasons for vaccine hesitancy may fit into one of these 4 categories. One of them is lack of convenience, which we talked about. So availability, accessibility. And if you do have availability and accessibility to the vaccine, these families have access to the vaccine, we appealing to this family by making the vaccine available at a time and a place, language that is familiar to them. The other one is complacency, or perceived low risk of serious disease among the youth. As we know, last year, when COVID first started, it was affecting mostly adults and older adults. And now that has changed. So how are we making sure that our families are understanding this? The third aspect of it is lack of confidence, and lack of confidence of the effectiveness and safety of the vaccine, of the system in general, policymakers, just to name a few. And then finally, low priority. Our families have many issues and circumstances going on, and this may not be a priority to them at this point in time. So we need to take all those into consideration. So generally, hesitancy to get vaccinated is first dictated by practicality, as Dr. Madoff and you have been talking about, vaccine availability, the proximity of the vaccination site to home and work, the ability to find time to get vaccinated, the ability to get excuse from work to get vaccinated. But hesitancy, and also refers to delaying the vaccine at its most basic level, is a personal decision-making that reflects individual thinking and decision-making process.
Right. That's so helpful. Dr. Nethersole, some thoughts around, the data showing that the COVID-19 vaccine has, this hesitancy, or some of the factors that Dr. Polanco just talked about are higher in some groups, communities than others. What are we seeing there exactly?
So I think there are several factors that, that are interesting to look at and that give us some information about what's going on. Looking at age, for example, and age differences. If you look at the state data, certainly for Boston, where we are, the vaccination rate for the 16 to 19-year-olds currently is actually lower than for the 12 to 15-year-olds. So that's sort of one thing that I think it's important for people to both be aware of, and then also think about how do you prioritize that age group? That's sort of a tough age group because they're old enough that you can't make them if they don't want, as you can for a 12-year-old if a parent wants them to get it, and also they're out and about, and again may have other priorities or feel they're at lower risk. So the things that we talked about before. I think there definitely have been some correlates with both the economic status. Lower incomes have been associated with more vaccine hesitancy, as well as with education. So people with college degrees are less likely to be hesitant than those without. But keep in mind that these are all sort of general categorizations. I think it's really still important to understand that whatever communication approach you're going to use really needs to be tailored to that individual and that person, regardless of what group they belong to, and not make any presuppositions about that.
Right. So, there's been a lot of discussion, within the media as well around vaccine hesitancy being more or less common in racial or ethnic groups. What are your thoughts on that?
Well, again, there are definitely differences in vaccine rates based on race and ethnicity, both across the state and in particular communities. The reasons for that, I don't think are totally known. I think that hesitancy, might maybe some more differences in hesitancy. I think if you look at history and thinking about how, particularly present over the last year or so, we've learned and talked about how racism and the impact of the healthcare system have really intertwined to sometimes create issues of trust. And so again, keep that in mind, but I wouldn't presuppose. In other words, you having a conversation from someone who's an ethnic minority group, don't presuppose that this is how they feel. I think that it's just sort of a general population marker more than anything else. The example I would give is that as you look at certain communities that have had significant experience with COVID-19 affecting their communities, their vaccination rates are actually pretty high. Chelsea is the example. They were very much impacted by the pandemic at the beginning. It's a community that's a largely Latino community, not a high income community. And yet, if you look at their vaccination rates, they're actually higher than the state average. And it's partly because there's been a lot of community effort and a lot of community support and a response to what's actually been seen on a day-to-day basis. So I think while it's important to be aware of the concerns about trust, and particularly trust in minority populations, populations of color, that if you really look at it from a community lens and from working with community partners in that community, you really can have good, strong conversations about how to communicate effectively, what other support do people need, what other things will help facilitate that. So the key is really these important individual conversations.
Absolutely. So we're just going to shift gears a little bit and talk about what data is most meaningful in addressing some of this vaccine hesitancy that we're talking about. So at this point in the pandemic, those that were very eager and willing to get vaccinated have done so. They've gotten their shots, they're fully vaccinated. And then there are those who are not yet vaccinated, but they're not exactly, opposed to getting vaccinated. And then there are those that are just strongly opposed to vaccination. So, Dr. Madoff, what is more common at this point in this sort of vaccine square off that we're having right now? Vaccine hesitant families or these vaccine refusers? And can you talk a little bit about what the difference is?
Yeah, it's a complicated question, as I'm sure you know, and exact numbers at this point in our vaccination campaign are hard to come by. But we know that vaccine, and we prefer to talk about vaccine confidence rather than vaccine hesitancy, and vaccine confidence does come in different forms, and there are people, the vast majority of people are willing and even eager to get vaccinated, and that's important to recognize. There is another group of people for whom it's really, as others have said, it's a matter of convenience and ease of getting vaccinated and finding access to vaccines. And I think our early emphasis on mass vaccination sites, was good for many, but it wasn't good for everybody. And trying to get people to that last block or mile was sometimes difficult. And I think I've always felt strongly that providers, individual providers, are our best our best tool for getting people vaccinated, particularly those who aren't eager and willing to wend their way to a vaccine site, but are eager to have a conversation with their provider. And as with all vaccines, I believe that with COVID vaccine, a strong provider recommendation and is the most important thing to getting people vaccinated. If you, the provider, say to your patient, it's time for your COVID vaccine. I personally have gotten vaccinated. I recommend it for my family and loved ones. Roll up your sleeve, please, is the best approach to getting the most people vaccinated, even those who have some degree of hesitancy about it. Now, there are going to be those who are more hesitant and have a stronger desire to avoid vaccination for whatever reason. And that group also comes in many flavors. And, that runs a gamut from, people who are anti-government to people who are very, sort of a all-natural demographic and don't want to introduce a foreign substance into their bodies. And I think, again, many folks it's really important to engage with those individuals and to understand what their reasons are. It's not just you're trying to convince them of something, it's you're listening to them and understanding their concerns and their reasons behind it, and recognizing that you're not going to be able, at least on the first try, to get everybody to be vaccinated. Sometimes it can take a second visit or a third visit. People come back and reconsider or see others around them getting vaccinated and sort of come around. And then there are people who you're not going to vaccinate, that just aren't going to come around. And it's important to recognize that too, and that you're not going to win every individual over. We see in Massachusetts, again, we see a certain rate of vaccine exemptions, a pretty low, steady rate of medical exemptions from vaccination. And then in Massachusetts, we also, even for mandatory vaccinations, COVID vaccines aren't in that category, at least not now. Even for mandatory school vaccinations, religious exemptions are allowed in Massachusetts. And that's, overall, a very small percentage of individuals choose that, even though it's very pretty easy to do that in this state to get a religious exemption. So, will there be school mandates for COVID vaccine? And I think that's a possibility in the future, and that may be another tool for increasing our vaccination rates in young people. And of course, the clinical trials around younger children are still ongoing. We don't even have those data yet. So where exactly, when that will happen is also an open question. I think I've diverged from your point a little bit, but hopefully that's.
No, not at all. I think some of the key words that, have come up frequently among the three of you has been around really just listening, individual, conversations, and really listening and not just dismissing, some of the patient, some of their concerns or dismissing them just overall, but really, like you said, sometimes it could just take a couple of conversations. And I know that all three of you have probably encountered that. But I think listening is one of the most important things that we can do. I just kind of want to talk a little bit about education and information gathering. So Dr. Polanco, what is the best information we should use right now to educate parents?
Yeah, I think that we just have to first send a clear message. And that message is that the vaccine, like the COVID vaccine specifically, is safe, is effective, and serious disease can occur if the children and adolescents are not immunized. So we have to focus on education that empathizes with parents' desire to protect their children. We know that one of the reasons that they are not vaccinating or delaying the vaccination right now is because they're concerned about possible side effects, short-term, long-term. So we have to understand them and also educate them using that angle. And, we also have to answer, like you said, answer their questions. There's a lot of questions about the vaccine, the trials, the vaccine itself, given that we have told the world that it's a different vaccine because it is, and any potential, side effects, like I mentioned earlier. So in terms of like, what type of information do we talk about? When it comes to safety, I will say that it's really important for parents to know that all three vaccines authorized for emergency use by the FDA have been thoroughly tested and found to be safe and effective in preventing severe COVID-19. I know right now only the Pfizer is approved for use in children 12 and older. But I know that the other companies are also looking into and doing trials so that they are also available for children. And the testing process is another question that comes up. How was this vaccine developed so fast? And parents may think that there were some steps that were skipped during this process. And just reassuring them that the vaccine developers conducted some stages of the process while at the same time gathering as much data to be able to come up with a product as quickly as possible, given how devastating the COVID vaccine, COVID epidemic had been when it started in 2020. Another point to make is that one of the reasons why it was developed so fast is because governments throughout the world use funds and gave those funds to the vaccine developers so they can advance and make the vaccine as soon as possible. I also tell them that millions of people in the United States alone have been safely vaccinated, and that all COVID-19 vaccines continue to undergo continuous and intense safety monitoring. In terms of efficacy, we remind parents and families that vaccines are one of the most successful public health interventions. This is one of the things that the American Academy of Pediatrics talks about often. They have led to the elimination and control of diseases that were once common, such as polio. And I talked about earlier, some parents not living or having relatives who experience diseases that are now prevented due to our vaccine immunization schedule. Finally, in terms of efficacy, I tell my parents that clinical trials of COVID-19 vaccines are currently authorized for emergency use in the United States and have shown high efficacy in preventing symptoms, including moderate and severe disease with COVID. When it comes to the Delta variant, which is the most recent topic that I address with the families, I mentioned that in the US, the Delta variant has shown that it's very highly transmissible, and it's driving an uptick in COVID-19 cases, primarily among the unvaccinated. And we know that the COVID-19 Delta variant is now responsible for more than 80% of the new coronavirus infections in the United States. And there's actually been an increase in hospitalizations. And we here at Boston Children's have seen the increase in hospitalizations in the past few months. Another point that I address with families is that the COVID-19 vaccines remain highly effective at preventing severe disease and death against the Delta variant. So this is a question that, well, if these vaccines were developed before we knew about the variants, how are they are they protecting us from the variants? And the answer is yes. So far, they have shown that they are. Again, but being honest and saying that the vaccines are not 100% effective, and some fully vaccinated people will become infected, the term we use for breakthrough infection, they may experience illness. But these patients who are vaccinated, the vaccine will still provide them with strong protection against serious illness and death. And I think that's a really a point that we have to drive home with parents, and trying to be as transparent as possible. I myself tell them, my experience with the COVID vaccine. A lot of times they ask me about my own family, my children, would I vaccinate them? And I tell them that I have children who are not of the age to be vaccinated, and I can't wait for them to tell me that they are eligible to be vaccinated, because I'm definitely going to get them vaccinated.
Absolutely. I think so much there's this movable middle of folks that, are not, against vaccines, but are just like we were talking about, waiting, or they just weren't sure, or, they feel like, well, I'm healthy enough, let me just wait and see. It's still an emergency use, but I do feel like there is this movable middle, and a lot of it comes from just sort of what you guys are all sharing, which is these personalized, conversations, these one-on-one conversations where you're listening and providing feedback and giving information and education in a manner that I feel like is, a little bit easier for them one-on-one, as opposed to just all of this information coming at people and saying, if you don't get vaccinated, it's, you're terrible and you're not, contributing to the health and well-being of the community. I think that's the wrong way to do it. And I think what you've all addressed is this sort of like personal approach. One of the biggest issues right now that we are facing, and a lot of people that haven't gotten vaccinated that are finding themselves in Louisiana or down in Texas or in these, they're overwhelming these ICUs, and they did not get vaccinated, and they're feeling regretful. And a lot of them are reporting, I wasn't getting my information from the right places, or I just got a lot of misinformation about the vaccine. So, Dr. Nethersole, how do we counteract people who are getting information from the wrong sources, or paying attention to education or information about the vaccine that is just incorrect? What are some of the things that we might be able to do?
Yeah, that's an interesting question. And actually, before I completely answer it, I do want to sort of build on the point you were mentioning before about the individual conversations, from a trusted source, as a primary care provider. One of the things that I think that is challenging in pediatric practices is, as the provider, is time. These conversations do take time, and it can take, it's not a 1 minute conversation. It's a 10-minute conversation, at least usually, and you can't add that 10-minute conversation to everybody you're seeing in your office. So I think one of the things that's important is to think about how you utilize other people who are working with you in your practice to help be the source of information for some of that as well. So, what's the approach that your nurses are taking? What's the approach that your front desk people are taking when they check in? Do they have, information or specific sentences and words and things that they use to help encourage people? The nurses, what are the nurses doing? So really thinking it not as just not about just the primary provider, and that conversation that they're having, but everyone who works in the office. And I think that hearing it from multiple different people in multiple ways is actually particularly useful. In terms of the getting data from the wrong sources, part of counteracting getting that data from the wrong sources is making sure they're getting it from the right sources. So pointing people to the appropriate place is really important. A lot of people search for vaccine information online, but obviously not everything that's available is reliable. So explaining to parents how to judge the reliability of a source, is it an expert who's doing it, or is it someone sharing their opinion who has no background in the area? There's a lot of detail that you can get into, whether you have conclusive findings or correlations in terms of side effects, those kinds of things that I think, again, are hard to parse out if you don't read the information closely. So I think those are all important kinds of things that you want to share. So sending people to the reliable sources is important. The CDC site is always important. Mass.gov, I actually think both for families and actually for pediatricians, I really encourage people to look at the data that's on the state website. It's just amazing in terms of, vaccination data, case data. You can look at it through municipality, through zip code, through age, through rate. I mean, you can look at it in every way. And so I think it's actually important for providers to look even within their own communities to see, well, what are the numbers? What are the vaccination numbers? What are they across different age groups? Where are the places that are struggling, and have some understanding of that as they're approaching managing their patients.
Absolutely. And Dr. Madoff, I think you talked a little bit about community ambassadors. Are some of these community ambassadors also having conversations or direct conversations about, helping to counteract some of this misinformation? Are you getting any feedback around that?
Yes, of course, that's an important part of their role is countering misinformation, and unfortunately, misinformation is out there, and it's a little bit of a vicious cycle as people get information from a bad source, and it encourages more of that. It's part of the phenomena that we see around social media and the kind of ways that people become confined to a community that feeds on itself with misinformation. I wanted to add, Dr. Nethersole, and thank you for the comments about the DPH information, which we're proud of how much data we do get out there. Another really good source is the Immunization Action Coalition, which is at immunize.org, and it's a great source for both public and particularly for providers. It really has some great fact sheets and information and ways to communicate. And the whole issue of vaccine confidence is a whole discipline into itself, and it's something that we very actively work on at DPH. There's a vaccine confidence initiative that's out there, and something that we do try to promote and try to engage with both the provider community and also with the general public. The Vaccine Equity Initiative and the ambassadors that you mentioned do one of their goals is to work with community organizations that are often, trusted sources within communities and try to get information to folks through those, through faith-based organizations, through community organizations, through all kinds of, schools and groups and other ways of getting information out there. You may touch on this later. I do want to mention that one of our goals is to have school-based clinics for vaccination as we go forward. And that's something that we're planning for as we get into the fall and as we get into hopefully younger age groups being eligible for vaccine. But also to echo what Dr. Polanco said, we are so fortunate to have such safe, effective vaccines. This soon after the discovery of a new pathogen, we're only really less than a couple of years into this into knowing about this pathogen at all, and certainly into the pandemic. And yet we have these vaccines that are over 90% effective and that have been used, I mean, in over 2 billion people. And there are very few things that we know so much about and that we've monitored the safety of so closely as these vaccines, and they have been just amazingly safe and effective. So I think it's just important to keep on that message.
Absolutely, it's amazing. Just the how effective they are and how effective they've been and protecting against serious disease. So let's just do a quick roundtable, because I know we've touched on this quite a bit throughout the course of this webinar. Each one of you, just to answer really quickly, what do you feel is the most important thing to do when you're addressing the COVID vaccine with a parent? Dr. Polanco, can you start?
Yeah, of course. Before I answer that, I want to say that talking about sources, I take care of a predominantly Latino community, and a lot of them are Spanish speaking only. So I just want to say that the Department of Public Health here in Massachusetts has information in many different languages. I often use the Spanish one. So the website is easily to get all this information for patients and families that do not speak English, the CDC as well. So you can use some of those sources. In terms of like closed up arguments, I will say the clear message that I talked about earlier: the COVID vaccine is safe, effective, and can prevent serious illness, especially including the Delta variant. And any efforts to decrease hesitancy or delay in vaccine among parents must be based on deep respect and understanding. And as Dr. Nethersole mentioned, a lot of the delay happens because there's lack of trust based on our history of racism and how we have treated certain populations. So it is now the time to take the time to answer the questions and concerns that they have, and proactively broach the subject and not wait specifically for the parent to bring it up. I mentioned that right now, in August, a lot of you and a lot of us are doing physicals because school is about to start or have already started. And during the physicals, I always talk about vaccines. So I say, you're due for this, and that, or the COVID vaccine. Or when I see that they already have the COVID vaccine, I say, I commend them for a great job on already protecting yourself or the parent protecting your children against COVID. If a parent has refused vaccines in the past, then the conversation should begin with asking them for permission to discuss vaccines and not just going right into it. You know your patients, your families know you, they trust you. So just approach them individually. And I'm sure that you have a good conversation, and hopefully that conversation will end in the patients getting vaccinated.
Definitely. Dr. Nethersole?
I think really what I mentioned earlier, everyone's an individual. So you really need to elicit the parents' concerns so that you can address them. So, asking open-ended questions, don't presume you know the reason why they're refusing. And really explore what the specific concern is that the parent has, and listen to that. Talk to them about why they have that concern, where they got that information from. Asking about what would motivate a change in their position. I think making sure that you're, at the same time also sharing with people, in some ways, the good story of how many patients have been vaccinated. I think it's one thing to not be vaccinated when only 20 or 30% of the population has been vaccinated, but when now 80, if 60 to 70% of the population is vaccinated and you're now one of the small ones, a lot of people sort of say, oh, and they reconsider and they think about, how they might change their thinking about this. So it's really just, what information can you help provide? But the only way you'll know that is by listening to them.
And I love your suggestion about when you said what information can we provide or how we can listen, but also creating it, an opportunity for like front desk staff or nursing or, others to get involved. So it's not just on the pediatrician, just in terms of scope of time. But I just love that suggestion about getting others involved as well. And then Dr. Madoff, your suggestions.
So what my colleagues have said is absolutely true. You know, just the provider giving a strong recommendation and engaging with your patient. One thing that I would add is that unlike some of the interventions that we use as providers, that vaccines protect not just the individual but those around them, and that there's you know, both an altruistic reason. You know, when getting vaccinated doesn't just protect you, it protects your loved ones, your family, your contacts. And that, you know, if you're not vaccinated, you're probably going to get COVID, and you're probably going to spread it to a bunch of other people. You know, the R naught for the Delta variant is probably, you know, more than 6, maybe 9. So that every person who gets infected is going to infect a whole bunch of other people, 8 or 9 other people maybe. And that by being vaccinated, you're stopping that. You're stopping both yourself from getting sick, but even if you don't get sick, maybe you just get a little mild infection, you might give it to someone who's going to get seriously ill or die from it. And so your getting vaccinated helps not just you, but your family, your loved ones, your community. And I think that's an important reason that some people will accept, will use to accept vaccination.
Absolutely. Oh, terrific. So we're just going to use the last 15 minutes for a quick live Q&A, and there have been some questions that have come in. And I know this has been the top of my mind, you know, that we're getting back to school. I have 2 teenagers who are, you know, sort of excited about the new year to come. And so that brings us to our first question here, back to school. So Dr. Madoff, I just want to direct this to you. Do you feel that once the vaccines are 100% FDA approved or mandated by school districts, do you think that will make it more acceptable by parents and guardians to get their children vaccinated? How do you feel about the mandated vaccine? So we'll start with you, but I'd love everyone just to chime in on that.
So I think there's two questions in there. I think one, will full FDA approval encourage people to get vaccinated? I hope so. I don't know that it's necessary. I think, you know, the approval process and the huge widespread use of the vaccines really is almost as important as FDA approval. I think FDA approval will come very soon. Full FDA approval, at least for the Pfizer vaccine, which is sort of first in line, will come very soon. And I hope that helps. I hope that convinces more people to get vaccinated. You know, I think mandates are controversial. I think they can have both, you know, positive and negative effects. Sometimes they can cause a pushback and people, you know, resent being told what to do. On the other hand, if you look at the difference between childhood and adult immunization rates, I think the school requirements for vaccine are extremely effective. And, you know, that's why, you know, 98% of our kindergartners are vaccinated against measles, for example, is because there's a school mandate. And I think you can make that case. And, you know, we're seeing a lot of colleges and universities mandate vaccines, a lot of employers mandate vaccines, healthcare organizations mandate vaccines for their employees. And I think we're going to see increasingly mandates. I don't know yet, and it's certainly not my decision whether there will be a school mandate. I think, you know, we'll see how things go, and we'll see whether there's some CDC, ACIP guidance on that topic, for example.
Okay. Just another question. Many of my patients feel distrustful of the NIH and the CDC. Do you have any suggestions for how to respond to more generalized distrust of the system in the industry? Who would be, anyone willing to talk a little bit about that? Dr. Nethersall?
Well, I think we've actually talked about this already. I think that the way you have to build trust, and that the way that you do that is by telling people the truth, by giving them the data, but also by having them talk to trusted sources. So and engage others in their spheres to who are trusted to have those conversations and to help build trust. So, it's the community connections, it's the community support. Is it the church and the pastor who's at the church, who's an important ally to recruit to help support some of that? People have legitimate reasons for not trusting, and while we can sort of understand that and talk about it, we also have to say, well, now we're moving forward, and this is how this disease is impacting our community and our way of life, and here's how we can address this together. So I think this idea of it not just being on one person, they may not trust a particular health system or whatever, but what about all of the other communities and sectors that are engaged, whether it's as a trusted community members, church, school, other parts of the community that can be brought in and engaged in this.
Oh, absolutely. Dr. Polanco, I want to direct this question to you. How do I put perceived dangers from vaccination into perspective? So what are some sources I can use for these rare adverse events that may happen, specifically with kids?
Yes, that's a great question. Thank you to the pediatrician who asked. And most recently, the one concern that I've been getting from a lot of my families is the concern about myocarditis, and with adolescents and getting their vaccine. And I have had a case, at least one of my patients who had a case of myocarditis after the first dose of the Pfizer vaccine. And I tell them that, what I have seen, and like Dr. Nethersole was saying, sharing the data that we have, whether it's sharing, going to the CDC, going to the Massachusetts Department of Public Health, showing the numbers and how the benefits right now have consistently shown that they're outweighing the risk of getting vaccinated. So, with the specific concern of myocarditis, I tell them that a lot of the patients who did develop this have developed mild disease, that we have been monitoring them really closely. And for my patient that I have in my practice that developed this right now is doing really well, and actually, has been followed by specialists who have recommended not being followed anymore. I tell them the truth, I show them the data and tell them what I think. And a lot of times, they take it and they feel more comforted with that information. And sometimes I tell them, take time and come back. I want to make sure that I mentioned this, is that we don't need to convince anyone, because I think that's not the point. We have to educate everyone about the vaccination. And that's how I leave it with my parents. I start by saying, I give them my own story, how at the beginning I had my own concerns with the vaccine when I got vaccinated, and how then I got vaccinated. It's been over 8 months. I've been doing very well. And I'm thankful because I haven't had the COVID, even though I've taken care of patients with COVID. And I think the vaccine primarily brings that protection. So telling them that information, if you feel comfortable sharing your own story with the COVID vaccine and how you came about making the decision for yourself. And in the end, telling them that you are here to protect them, and that's your job. And you wouldn't make a recommendation that you yourself knew wasn't the right thing to do. And right now, getting vaccinated is the recommendation that we're given.
The other thing that I would add to that is that when you talk about risk of side effects, is you have to compare that risk to you have to talk about the math a little bit and sort of give the idea of what the numbers are. So if it's 1 in 100,000, compare that to other risks that we take every day as part of our daily lives. And so I think when you have to, I agree, with Dr. Polanco Waters that you need to say the truth, and here's what it is, but also say, but we drive in our car every day to go do X. And there are risks involved in those two, and some of the risks can be actually fairly similar to the risks for, in terms of absolute numbers, in terms of the risks for side effects from the vaccination.
I would just add that in one way it's easier with COVID than with some of the other vaccines. I mean, almost nobody knows anyone who's had polio, for example, but we all know people who've had COVID, and even people who've become seriously ill and 18,000 deaths just in Massachusetts from COVID. So it's a little, in some ways, easier to convey the risk of the risk and benefit of a vaccine. That the risks are really, really minimal from the vaccines, but the risks of illness with COVID are quite real.
Absolutely. This has been, this has been just terrific, and we just have a few minutes left, and I just wanted to leave it if there was anything additional that we didn't cover, that you wanted to be able to share, anything we missed. I just wanted to make sure to just go around and give folks a chance to put anything out there.
I'll just say thank you to you for having us here today, and also to the providers who have been, really the front line and been bearing the brunt of a really difficult couple of years.
Absolutely. And I'll just finish with thanking everyone for attending. And just as a reminder, this has been recorded, so there will be a link available. So if there's information that you missed or you were trying to jot down, I think there were some excellent examples shared from all of you. I thought this was a lively discussion. So the recording will be made available. Feel free to share it with your colleagues. For more resources about COVID-19 and kids health, you can visit our website at bostonchildrens.org/COVID. And as we've said, the state has just an amazing and robust website available too for data and for sources there as well. So thank you all so very much. And we might be doing this again in a couple of months, who knows? Thank you all.
Thank you for having us.
Thanks. Bye-bye.